Hi, welcome to episode 9 of OSCE with Modal ES. Today we will be doing a procedure called urinalysis. What is urinalysis? This is a procedure of analyzing urine's physical and chemical properties to make sure that you test for the presence of diseases in the body system. As part of standard precautions, make sure that you always wash your hands before doing or commencing with any procedure. Greet your patient and introduce yourself as in accordance with patient's right charter that states that every patient has a right to be nursed by a well-identified personnel. Show them your name badge if possible. After introducing yourself, introduce your assessors of the day and the reasons why they are there. This is done to create respect, to gain trust, and to also familiarize the patient with the staff around. Explain to the patient why are you there. Give a brief or a short explanation of the procedure that you want to do to the patient as part of information. Ask the patient for consent once the patient understands the procedure and the reasons why you are there. Once consent is achieved, assess your patient's comfortability to check if the patient needs anything before you start. Check the immediate environment to comply with the safety and security of the patient and the personnel doing the procedure. Also check the prescription in the patient's file to comply with the prescription and to ascertain the doctor's orders. Failure to identify the patient correctly will lead to disciplinary action, and it might cause the patient to receive wrong procedures or medication. Make sure that you identify your patient according to your hospital policy. The following tools are very important for this procedure. You must make sure that you have a graduated glass to pour your urine test strips container with strips inside, clean bedpan or urinal used to collect urine from the patient, a watch with second hand, gloves, fresh urine from the patient, hand soap to decontaminate your hands, antiseptic hand spray to decontaminate your hands, paper towel, a small paper, a receiver for soiled disposable items. Properly do your hand wash using warm water and soap. You may also do decontamination using the hand spray. Make sure that your patient is comfortable before you do any procedure. Provide bedpan if female, or provide urinal jug if male, for the patient to collect urine inside. Assist if the patient cannot be able to do that by themselves. Allow those who can walk to go to the sluice room to collect urine. Make sure that you screen for the patient to allow privacy. This is part of critical point. Once you've collected your urine, proceed to go to the sluice room with your urine. Urinalysis is one of the longest procedures. Sometimes because of time, the assessors they might say, you may start in the sluice room because urine is already collected. Do not be confused. Decontaminate your hands as always. Make sure that you focus and remember, you are starting at the sluice room, not at the patient's side bed. Once you are in the sluice room, start by decontaminating your hands to prevent cross-infection. Once done, wear your gloves, your apron, and a mask if a need arises. Very, very important. Once your assessor says that you must start your procedure at the sluice room because everything has been collected. You must start by making sure that your urine is well identified. There is a name of the patient because your patient's name might be John and the urine specimen is saying Peter. You must make sure that there is date and time. Possibilities are your urine was taken yesterday around 12. It means that your urine has expired and it will give you wrong readings. Once you've identified your urine, pour your urine in a graduated glass and put it on a flat surface. This will allow you to read the volume of the urine. Lift up the jar urine against the light. This allows you to check the color. Deposits in the urine which is called sediments. And also while you are putting your glass up, you will feel or you will sense the smell of the urine. Under chemical properties, check first the expiry date on the reagent strip container to ensure that the strips have not expired. This is to eliminate the possibility of getting wrong readings from the urine. Read the instructions on the container just to understand the time to be taken for each color. Open and remove one strip from the container without contaminating the entire strips inside. Close the container tightly immediately. Check if the strip colors are matching the colors on the test strip container. Once you are certain of this, immerse the strip inside the urine for less than 5 seconds. Remove excess urine by briefly sliding the strip on the brim of the urine glass. After waiting the required time, read the reagent strip comparing to the urine strip container. Once done, record your findings on a scrap paper that you have and discard away the urine strip into the waste plastic that you have near you. While you wait for your reading time to come to pass, explain the following to your assessors. Ma'am, if there's a positive readings on glucose, it means that the patient is diabetic. If there's a positive reading on protein, it means that my patient might be facing kidney problems. If there's urobilinogen in the urine, it means that there is a liver disease. If there's blood, it may mean that if it's female, my patient is on menstruation, or there's actually internal bleeding if male or female at the same time. If there's ketones in the urine, it may indicate that my patient is diabetic ketoacidosis or is on starvation, is fasting. pH, the normal levels or readings of pH is in between 4.6 to 8.0, which is the normal range. If there's bilirubin in the urine, it means that there may be presence of liver disease. The specific gravity of your urine, ma'am, is normally 0.010 to 0.025. If there's leukocyte, which is normally red at the last, it may indicate a bacterial infection. Once done, discard your urine into the sluice room. Make sure that you wash all the equipment that you are using a soapy water, and store appropriately and for allowance for other colleagues to come and do the same procedure. Remove your gloves and discard everything you've been using into the red plastic, and also in accordance with the waste segregation policy of your hospital. Before you proceed to the patient's bedside, decontaminate your hands. Once at the patient's bedside, check if your patient is still comfortable. Give patient feedback about the findings that you found on the urine. Once done, Proceed to your patient's booklet and compare the previous readings and the ones that you found today. Interpret to your assessors. To ensure continuity in nursing, make sure that you verbalize the need to reassess the patient at a later stage. This is to allow you to observe for any progress. Once more, make sure that your patient is comfortable. Open the screens. Thank your patient for the time they've given you, and thank your assessors. Record everything accordingly in the patient's file as in accordance with the record-keeping principles. And make sure that you report any abnormalities you found to the sister in charge.